Hi guys, this is the third part of the series of videos that we have prepared on writing a standard medical articles. In the previous two videos, we already discussed how to write the introduction section of your article in which you need to tell the readers what's the gap in the literature and what's your research question and your aims to do the study. In the second video, we discussed the methodology of your study and what you need to write in the method section of your study. And in this section, I'm going to talk about the general requirements for writing the results section. And similar to what I told you about writing the method section, most of the time in the results section, as you are going to talk about what you found already, the tense that you use is in past tense in English language. So results section is the place that you need to say what you found using the research question that you mentioned in the introduction section and the methodology that you used in the method section. Now you are going to tell the readers what exactly you found. And text-wise, this results section can be the shortest part of your article, excluding the title. So um, we all know that the title of your study is the shortest part of your article. However, excluding the title, the results section can be the shortest part text-wise. And the reason is that most of the time you can have different tables and figures, and many data can be presented very concisely in tables and figures. So you don't need to write about those results. And I will give you other examples in future minutes about how you can use different parts of and different components of a results section. So in writing, you can use very short sentences, just telling the readers what you exactly found. And there is a place in tables and figures that led you to show the numbers and percentages or p-values, and all of them can be compacted in the tables or sometimes in some figures. The next thing to consider is that while you are reporting your results, please just talk about the relevant findings. And what do I mean by relevant findings is that you need to just talk about those findings that are related to the research question. So you have a research question, you use the methodology to answer that research question, and whatever you found that is related to that research question is important to be reported. It is very probable that while you are answering your research question and you are finding some results, some incidental findings are also shown up. These incidental findings haven't come from your research question, and you didn't aim to gather information about those incidental findings. So they can act as some hypothesis generating issues. So it is possible that you have some incidental findings, but these findings must be tested in another study using another methodology to be sure that these findings are correct. So just talk about those findings that are related to your research question, and your methodology was planned to answer those findings. The first paragraph of your results section is the paragraph that is devoted to the basic descriptive data of your patients or participants. So in order for readers to understand the atmosphere and environment of your study and research, it is very good idea that talk about the basic descriptive data in the first paragraph of your results section. So you need to tell the readers how many patients or participants were included in the study, how many of them were excluded from the study, what was the mean age of the participants, and any other descriptive data that are important for the readers to know. So this is the first thing. When you are setting up your research question and your methodology to answer that research question, you also set up some outcomes to reach. So you are evaluating some patients. You have divided those patients to two groups, and they are scheduled for being operated on. And one of the outcomes that you are considering is, for example, mortality after the surgery. The second outcome would be the rate of renal failure, for example, in both groups. When you are going to report about these outcomes, firstly, report the primary outcome and then report your findings about the secondary or tertiary outcomes. So it is very important to be constructive, and in the same order that you have mentioned your outcomes in the method section, you have to answer the results and report the results in the results section as well. The next thing to consider is that results section is composed of different parts or different components. A results section is consisted of some text, which are the written part of your results, some tables, which give the evidence for the story that you have written in the text of your results, and there are some figures that illustrate the highlight. There must be a balance and harmony between different parts and different components of your results section. The main point is that whatever you have written in your tables shouldn't be repeated in the text, and whatever you have written in the text shouldn't be repeated in the tables as well, or in figures. I can give you an example. Imagine that you have done a study on two groups of patients, and you are going to report the mean age of the patients in two different groups. In the text of your results, you may write that mean age of the participants in group 1 was more than the mean age of the participant in group 2. And then refer the readers to table 1. And in table 1, you give evidence, you give numbers, you give percent, and you give p-value showing any possible differences between these two groups. The bad approach is that you start talking about all these data in the written part of your results, saying that the mean age of the participant in group 1 was, for example, 20 years plus minus 2 years, and the mean age of the participants in group 2 was 30 years plus minus 3 years, and then again refer the participants to the table, repeating all these numbers and mean age and the related p-value in the tables. So these different parts and components of a results section should complement each other. They are not the place that you repeat something. So text tells the story, tables give the evidence for that story, and figures highlight, illustrate the highlight. A mistake that many junior researchers may sometimes do is that they are using these visuals very unnecessarily. So sometimes it is possible to write only one sentence reporting what exactly you want to say, but these junior researchers try to create some figures in order to show up that they have done something sophisticated, for example. And a very good example of this approach is what you can see in this slide. And you can see that in this figure, the authors try to show the age distribution of patients in their groups. And at the same time, they are going to tell us the male to female ratio by using a pie chart. All of these information can be written just in one sentence without using any figures. And these unnecessary figures use your space, your limited space in different parts of your article. So you need those spaces in order to report more important findings. So when you are not when it's not as necessary, don't use any unnecessary visuals. This is the good point to consider. As I told you earlier, tables are very important. And it is very probable that many researchers, when they want to scan your article, just go through the title of your article, go through the for example, your research question, a very rapid evaluation of your methodology, and then they evaluate your tables in order to receive most of information in the table. So it is very important for you to know how to design your table and how to create a table that is at the same time informative and easy to comprehend. So there are some characteristics that good tables should have. And this phrase is from the book How to Write a Paper, from one of the BMJ Publishing, one of the books by BMJ Publishing, and you can download that and read those parts. And in these parts related to tables, the book mentions that there should be some characteristics for tables. First of all, the tables should have visual impact. Second one, the tables should be informative. They should be easy to comprehend. And more importantly, tables should be a standalone. And what do I mean by a standalone is that they must be interpreted without needing to refer to the text. So if anybody comes to read your article and just take a look at your tables, they should be able to understand what your tables are about just by reading the title of the table and the element of information in the table. So a good example of such tables is something like this. The title of the table tells the readers that this table is the results of comparison of preoperative, perioperative, and postoperative continuous prognostic factors between the two groups with and without the composite outcome. And in different variables of these tables shows that age, body mass index, last pre-operation creatinine, and other information. And the numbers and, for example, other determiners are clearly mentioned in this table for both groups of with complication and without complication. And the last column shows actually the p-value to tell the readers the possible differences between the two groups. In writing your results section, try not to include just percentages or p-values. The method to report medical articles has progressed during the last 10, 20 years. And good journals, reputable journals, don't accept that you just report some percentages or p-values. They want you to show something when you are reporting your results that can help to show more precision. So most of the time when you are going to report p-values, it is possible that you use to report confidence interval as well. So this tells us an important approach before starting your study, to consult with methodologists and biostatisticians before doing anything. So at the first step, that when you are going to set up your study, it's very important for you to start consultation with a methodologist and a biostatistician, so that they can help you to and tell you what kind of information are important that you need to gather during your study, so that they later on can help you in analysis of the data and to report some other elements rather than p-values or percentages. So it is possible that for many of the studies that are related to treatment of treatment of patients, and when these studies are evaluating, for example, different treatment therapeutic approach, it is possible that more relevant statistical determiners are needed to be reported. For example, absolute risk or number needed to treat. And one more important thing is that when you are reporting your p-values, please don't write p was non-significant. You need to report the exact amount of p, whether this p-value was significant or not significant. So the exact amount of p, whatever that biostatistician after analysis of your data will tell you, you need to write those exact amount of p-values in your study. So there might be some differences between p-value 0.06 and p-value 0.9. Both of them are non-significant, but there might be differences between these two. It is possible that lack of power or low power studies lead to those p-values that, for example, are non-significant, but they need to be interpreted by the readers. They need to be interpreted by peer reviewers to understand whether your results are reliable enough when you are reporting non-significant or not. So this is an important point. And the statistics that you report should support the statement that you are mentioning. What do I mean by that? Is that some junior researchers, for example, write there was no significant difference between the two groups regarding the mean age, but the numbers that are reporting as p-value is not aligned with what they report in the written part of their text. So it is very important to read and read and read again your article before submitting your article to a journal, or ask other friends, knowledgeable friends, of course, to read your articles to find these very probable mistakes during your results reporting. While you are reporting your results section, use the fewest table. What do I mean by this? I mean that whatever related information and results that you have, you should put them in a single table. It is a temptation that some junior researchers use many different tables in order to increase the page counts of their articles. It's not a good approach because if your article is accepted during the production phase of your study, all these tables should be put in the results section, and it would be a hard task for people working in a publishing company, for example, at the IMR Press, to lay out your manuscripts in a way that's readable enough and attractive for the readers to read. So all information related, for example, to the descriptive data of the patient, all information related to the, for example, treatment of the patients, those therapeutic management that were done by the researchers, all data related, for example, to the surgeries done on patients should be put in different tables. The maximum number of tables that can be used in a manuscript normally, as written in many instructions to authors of different journals, is something about 3 to 4, maximum 5 tables. So please try hard to keep these tables to the minimum. But it is possible that sometimes you have some tables and figures that you think that the readers should go through those tables and figures. But they are not as essential as the main tables that you have included in the results section. So in this case, you can attach or add these non-essential tables as a supplementary file to the manuscripts. Another important thing that you need to consider while you are writing the results section is that don't start to discuss the strengths and weaknesses of your study and the implications of the finding in the results section. The results section is just the section for you to write what you found. What you want to write about why this happened, or what is the implication of your findings, there is another room or place for you in the discussion to talk about those issues. So for now, just report your results. Don't write about the strengths of the study. Don't write about the weaknesses of your study. Don't write about the implications of your findings in the results. I have prepared some examples for you in this regard. These are 4 different phrases from different articles. And in the first phrase, it's read as the intervention group had lower hemoglobin A1C levels at 6 months compared to controls. And the authors gave us some mean difference and confidence interval, and it's good so far. However, later on, they start talking about something else, saying that this finding demonstrates the intervention's effectiveness in improving glycemic control. This is the elaboration. This is the explanation about the results. And the results section is not the place that you want to elaborate and explain about why this happened or what is the good thing about these results. Later on in the discussion, you can have enough space to talk about these issues. The next phrase reads as the dropout rate was higher in the control group than in the intervention group. Again, it's good at this point. But later on, the authors continue as possibly due to reduced motivation without access to personalized coaching. This phrase of possibly due to something is the explanation that you are giving to the readers about why this drop-off rate was different between 2 groups. And the results section is not a place for you to give this explanation. You need to keep this at the moment, and later on in the discussion, you can have enough space to talk about this and explain why you found different results in 2 groups. The third example reads as in total, 76% of participants reported using the decision aid at least once. Again, it's good at this point. However, the authors continue as this suggests high engagement with the platform. This suggesting high engagement with the platform is something about explanation and elaboration of why 76% of participants reported using the decision aid. And results section is not a place for that. The fourth phrase is a good one because it's just saying that low certainty evidence from a meta-analysis of 5 trials suggests that antibiotic prophylaxis may reduce the risk of postoperative infection. And this is done and it's finished. There is no explanation, elaboration about the finding, just the result. The last thing to mention is about some practical tips. You know, there are some reporting guidelines, and we are going to prepare a specific video about different reporting guidelines that you can use when you are going to write your articles. However, just for you to know some names, if you are doing, for example, a systematic review, when you are going to report systematic review, PRISMA guideline is a very good guideline that can help you to write different sections of your article. And as we are now talking about the results section, you can go through the results section of PRISMA. And in this results section of PRISMA, there are some questions, and this guidelines helps you to read these questions and write the answer of those questions in the results sections of your article. For example, in the study selection, the guideline asks you to describe the results of the search and the selection process. So if you have done a systematic review, in the results section, you need to write how you searched and selected different articles for your systematic review. If your study is a randomized clinical trial, consort guideline is a very good guideline that can help you to report your results section better. So again, you can refer to the results section of this consort guideline. And for example, in this section, the guideline asks you to write about the participant flow, including flow diagram. So you need to write for each group of your patients the numbers of participants who were randomly assigned or received intended intervention and so on. And the same is true for the observational studies. And again, there is another guideline called STROBE. And again, if you are doing an observational study, you can refer to this STROBE guideline. And in the results section of the STROBE asks you some question that you need to incorporate the answers about those questions in the results section of your observational studies. Thank you very much for your time, and please share your comments or questions with our colleagues at the IMR Press, and follow us on different social media, including LinkedIn. And I'm looking forward for the next video, which is about the discussion and how you can write a good discussion. Thanks.